Good morning and welcome to the House Executive Departments and Administration Committee. If I could ask Representative Kelly to lead us in the Pledge of Allegiance. Representative Kelly, lead us in the pledge. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. We have 8 remaining bills that we have not acted on, and it's time to start moving through some of those with executive session. With that, I will open the executive session on Senate Bill 486, and I will move Amendment 1688H. I'm not sure if any of them have made it down to. Do we have any extras that we can pass along, especially so that the executive director can get a copy? Yes. You have extras there? So I'll move 1688H. Is there a second?
I'll second.
Thank you, Representative Groda. So 1486 is the same bill that we saw and had interim studied previously, just to see if there were any remaining changes because we had some questions around legislative intent. I think that language is fine. What this does is in our most recent April JALCAR meeting, we approved rules around the Social Security Administration cost of living adjustment for the Medicaid income eligibility for the in and out Medicaid medical assistance. This is one that statutorily is required to update every January 1st, but without adding this language to 541A, that's something where it would have to come through the normal long rulemaking process. This language was checked with the Department of Health and Human Services. It's consistent with the 3-B that this would be following for another cost of living adjustment. So I'm moving this amendment just to reduce some of the complexity when the change is already statutorily directed. Is there any discussion on this amendment? Representative Groda?
So I just want to clarify that what we're doing is we're taking it out of rulemaking, but leaving it in statute. Is that correct?
No, that's not correct. What this is doing is it's allowing it to go through a more expedited process as opposed to the current process. So that it allows some waivers. Actually, I'll ask Mr. Osterhoff to clarify for us.
You think this is my first time at the table. Good morning, Douglas Osterhout, Director of the Division of Administrative Rules for the Office of Legislative Services. So essentially, this would still require HHS to put these numbers in rule, but they wouldn't have to go through the formal rulemaking process. It's a COLA adjustment. It's happened before. I do have 2 recommendations on the language if you're willing to entertain them.
I am willing to entertain that.
Minor stuff in the first sentence, and I wrote it down, I can give it to you, but it says rules adopted. I would add pursuant to RSA 167:3-C, Roman numeral 1. And then I also think on line 10, the language provided that recipients receive proper notice that the income level has been adjusted. It's standard practice at HHS. I don't think that needs to be in the exception, but those would be my only 2 recommendations. I can hand you this too if it helps.
Thank you. Actually, if you could hand that to our researcher, he can send that over to get that language drafted for us.
So let me know if it's clear. OLS can reach out to me if they have a question, but it should be clear.
Thank you. That's helpful. Does anybody else have any questions on this amendment, which we will be changing? Seeing none, with that, I will.
We're adopting this amendment?
No, with that, I will withdraw my motion to adopt the amendment.
And I'll withdraw my second.
And with that, I will recess this executive session until we have the amendment back from OLS with the changes. Thank you, and I appreciate that. Better to get it right now instead of trying to deal with that in the future. So that one we will be waiting on. Next, I will open the executive session on Senate Bill 567 relative to the composition of the Board of Dental Examiners. And I will pass out the amendment that would add House Bill 1286 to this bill. That was the one that would allow people to continue to get treatment from dentists, even if they don't want to have the x-rays. Right now, it's a violation of of their licensing conditions. It is a violation of standards, and they can have their license revoked if they don't follow all the guidelines from the American Dental Association regarding x-rays. While those are ideal, the question is, do we want to deny people care just because they don't want the x-rays? The policy that had passed this committee and the House was that we don't want to deny those people care. By adding this, we may be able to get to some language in a committee of conference that won't have people's licenses revoked if they're willing to keep patients on for cleanings or other treatment even after they refuse x-rays. So with that, I would move Amendment 1588H on Senate Bill 567. Thank you. And as I spoke, as I was handing that out, I think I addressed the topic and the reason for the amendment. Would you like to speak to the second? Thank you. Representative Grota?
So I just want to understand what we're saying is a patient can decline to have an X-ray. The dentist will not lose their license if they allow that. The dentist can sign a waiver. The patient can sign a waiver from the dentist, but the dentist need not treat the individual. Is that right?
That is correct.
Okay, thank you.
And my intention, if this language is not entirely satisfactory to the Senate, which they've sent the bill to interim study, so it suggests that, that we would discuss moving forward, just simply saying that if a patient declines the radiographs, the dentist can continue to treat them without losing their license, should they so choose. So that would leave it entirely within the realm of the dentist making that choice, but it would no longer be a licensing violation should they continue to treat somebody without those x-rays. Representative Sytek?
Do you want to announce the substitutes?
Oh, yes. Thank you. Yes. Thank you. And I do want to announce our substitutes for today. We have Representative Ouellette in for Representative Sellers. So welcome. Thank you. And we have Representative Devoid in for Representative Pearson. So welcome. Thank you both for joining us today. Is there any further discussion on this amendment? Representative DeRoy?
Do we have any idea what the Senate's problem is with this?
Yes, they're just concerned that this still doesn't address the issue that it's a licensing violation. And that's why being able to have a discussion about what exactly would need to be changed in the licensing requirements, that may be a way to get to a yes. If we can't get to a yes on this, I would expect that the committee of conference would then agree on just the one on changing it so we'd have a general practice dentist. But I believe that it's important to not deny people care, even if they don't want one part of the standard practice.
Thank you.
I'd rather have clean teeth with no x-rays than no treatment. Representative Grota?
So my concern is just that do we have, although we can, by putting it into law, typically licensing requirements are based from the Board of Dentistry, right? Correct. So do we have are we putting ourselves in conflict by saying that the license isn't suspended, and does that put us in conflict with the requirements of the Board of Dentistry are?
Well, thank you for that. Right now, the way that the language is written, which is what we can adopt by attaching the previous amendment, it doesn't touch the section on the licensing, which is 317A 17 2G, which actually it looks like there was a typo in the bill that it was J instead of G, that's saying that notwithstanding that the dentist may treat a patient. What my suggestion would be once either as a floor amendment, which we may be able to do, or a committee of conference amendment, would be to change the section that right now says that that they need to follow the clinical guidelines from the American Dental Association as adopted in whole or part by the board as published in the Dental Radiographic Examinations Recommendation for Patient Selection and Limiting Radiation Exposure and Recommendations in Radiographic Practices. Instead of having that G1A and B, consolidating that into one to then add, unless the patient refuses such exams and following these guidelines would lead to the patient being denied dental care. So that there would be the exemption that for a patient refusing those x-rays, it's already in the licensing statutes for the board that there is a way to not revoke that if they're willing to clean somebody's teeth, even though they're refusing the x-ray. There's nothing that would require them to treat a cavity if they believe that there's a cavity and the person is denying the x-ray. There's nothing that compels any particular treatment. By doing this, you would remove the risk to the license for somebody to continue to treat somebody after that window to get x-rays has closed. And that is a reason why people are currently being denied care.
I know you tried to answer my question, and I'm trying to figure out how what you just said answers my question. So are you saying that this amendment, we would need an additional floor amendment to take care of that?
I would say that what we passed, we believe already addressed it. The Senate didn't agree that it addressed the underlying issue of the licensing requirements at the board. And so that's why I looked before doing this to see that there may be a solid way forward in order to have that language in the licensing requirements that the legislature has given to the board. The licensing requirements for dentistry are far more prescriptive from the legislature to the dental board than any other professional, healthcare professional. And so by laying out a lot of these specific requirements to maintain licensure, it's rather arcane, but rewriting that whole section right now, I think is a pretty big undertaking and was not one that the prime sponsor or us were willing to do, to rewrite all of the board requirements for licensure as a dentist. What this would do would be to just change one section of that so kids are able to get care.
Okay, and are you saying that in line 10, the J should be a G?
Yes.
So are we going to then make a motion based on the fact that the J will be changed to a G so that we don't send out an amendment that is incorrect?
I'll ask the House clerk to see if we could make that change or if we need to adopt it in exactly the language that had passed the floor. So with that being the case, I probably will also recess this executive session and move to the next one. I apologize that this is coming up, but this is why we have an executive session and go through these bills so that we have an opportunity.
But I think
to do
there
this.
is a way to accept the amendment, knowing that, isn't there?
Did we do this already?
Yeah, I thought that we didn't do this, but I know that, for example, in a previous amendment in another committee, there was a typo, and the committee rejected it, but they could have accepted it. Is that right, Mr. Greenland?
Okay.
Correct. So I think that we can do it again, can we not? Or are we going to get our hands slapped?
Well, I actually suggest let's do that. I will move this amendment, changing the J to a G on line 10. We'll adopt it. We'll send it over to the clerk. If there's a problem, then we can change that while we are here today with the executive sessions. I'm all right having the new amendment number with that correction. Is there any challenges with doing that? Seeing none, so this will be on a discussion with it referencing 2G as opposed to 2J. And with that, is there further discussion on adopting this amendment? And are you asking about the underlying bill? Or, oh, sorry, asking about bill. Okay. Seeing none, when ready, the clerk can call the roll.
On adopting Amendment 588H and its possible successor, Representative Slotchie.
Sorry, I have Amendment 1588. Is that correct?
Yes.
With correction. So it will have a different number, but that's an appropriate way to note it.
Gotcha. Okay. Yes.
The son of 1588. The clerk votes yes. Representative DeVoid.
Yes.
Representative Bailey.
Aye.
Representative Willett.
Yes.
Representative, don't have a Tebow, do we?
No, we
No.
don't have a TiVo yet.
Representative DeRoy.
Yes.
Representative Kelly.
Yes.
Representative Grota.
Yes.
Representative Schmidt.
Yes.
Representative Davis.
Yes.
Representative Dargy.
Yes.
Representative Howard.
Yes.
Representative we don't have a DeVries either. Representative Long,
Yes.
Chair.
Yes.
It looks like 14-0.
Fantastic. And I will move ought to pass on Senate Bill 567 with son of Amendment 1588H. Is there a second? Second. Thank you. Or daughter of, whichever we prefer. Is there further discussion on this? The underlying bill is ensuring that there's a general dentist on the dental board. Seeing none, when ready, the clerk can call the roll.
Representative Slotchie.
Yes.
The clerk votes yes. Representative DeVoy.
Yes.
Representative Bailey.
Aye.
Representative Willett.
Yes.
Representative DeRoy.
Yes.
Representative Kelly.
Yes.
Representative Broder.
Yes.
Representative Schmidt.
Yes.
Representative Davis.
Yes.
Representative Dargy.
Yes.
Representative Howard.
Yes.
Representative Long,
Yes.
the chair,
Yes.
the same 14-0.
And I will keep this on the regular calendar just in case we do have the opportunity to amend it on the floor with those changes, pending what the clerk has to say. So I'll get myself that report today so that we can hit our House session next week, should we have that. Next, I will open the executive session on Senate Bill 572. Representative Grota, do you have an amendment? Sorry, do you have a motion?
I do have a motion, Madam Chair. I move ITL on Senate Bill 572.
And I'll second that. Would you like to speak to your motion?
Yes. So we heard this bill quite a while ago, and it was about the property at Concord Hospital. And there was a part of House Bill 2, I believe, that did not allow the sale of that part of that property. This bill would have allowed the property to be subdivided, and since we're not going to sell it, there is no need to have it subdivided. So therefore, I'm hoping that we will all support the motion of ITL.
And I'd say you stated that well. Is there further discussion? Seeing none, when ready, the clerk can call the roll.
Grota and
Leon.
so you second.
I second it, yes.
On ITL for SB 572, Representative Slotchie.
Yes.
The clerk votes yes. Representative DeVoy.
Yes.
Representative Bailey.
Aye.
Representative Willett.
Yes.
Representative DeRoy.
Yes.
Representative Kelly.
Yes.
Representative Grota.
Yes.
Representative Schmidt.
Yes.
Representative Davis.
Yes.
Representative Dargy.
Yes.
Representative Howard.
Yes.
Representative Long.
Yes.
The chair.
Yes.
A familiar 14-0.
And is there any objection to putting that on the consent calendar? Seeing none, that'll go on consent. Next, I'll open the executive session on Senate Bill 504. I'll pass out an amendment. I actually have two different amendments, and I can speak to this process here. So there's a couple of different things that we've been looking at as far as this bill. I distributed an amendment last time that we met that had some language separating out everything except prescribing and prescribing, but that brought a lot of clunkiness and confusion to that. Instead of adding a new section 7, what I have done is I've changed that section 6 around the prescribing, ordering, administration, and interpretation of laboratory tests, controlled and non-controlled drugs and devices, to add the phrase in accordance with applicable state and federal law after speaking with a group of the pharmacists. That would ensure that this is not giving any sort of shortcut to pharmacists prescribing opioids. That's in section 1 of this bill here, in section 1 of the amendment. 1742, yes. So, and I will move amendment 1742H. Is there a second? Seconded by Representative DeRoy. So what this would do is instead, previously I had distributed one where it created a new 7 and then renumbered the others by pulling out prescribing and removing the word controlled. But right now, prescribing of controlled drugs is not permitted to pharmacists in the state of New Hampshire because there's no agreement with the DEA. And if we were to adopt this, if we did want a policy of allowing pharmacists to prescribe buprenorphine, I believe it's called, one of the drugs for the medication-assisted treatment for people with opioid use dependency in areas where there's no other access to care. There would still need to be steps taken with changing rules and other things to ensure that we could have access to that medication-assisted therapy. This is not something that opens the door for it, and that's the only one where that's the one that I'm aware of, where there is a current standard of practice for pharmacists where permitted by state and federal law to prescribe controlled drugs. This is one where it just simply does not close the door on that, and that is one of the very important things when we're looking at rural health transformation, to make sure that people with opioid use disorder get the appropriate treatment. So having something that specifically excludes prescribing of controlled drugs then would mean that the pharmacist cannot be providing this important care. However, stating that it needs to be in accordance with applicable state and federal law means that there's no shortcut. There's a lot of different controls around controlled drugs with the DEA, and we're not going to see something, if somebody were to run some sort of pill mill, that would already be in violation of standard of care, and that would be against what we're passing in this law. Additionally, then if we look down at the lines 15 through 24 of this amendment, that is the language we had also seen because the certified pharmacy technician had been left out of the pharmacist administration of vaccines in a previous bill. And this, at the request of the retail pharmacist, removes the reference to the United States Centers for Disease Control and Prevention Advisory Committee on Immunization Practices, or successor organization. I feel it's cleaner not to reference to outside standards when there's already standards of practice. So I'm supporting that change. The one part that is new and we probably need to have some discussion on is lines 8 through 13, because I've been contacted by those who do the testing for our licensed advanced pharmacy technicians and our other pharmacists. They've stated that they do provide that information and that they do that through NDAs. However, the letter I have from them right now doesn't clearly state that. It talks about it for the jurisprudence exams. So I wouldn't be comfortable quite moving forward with this until we have a letter that states that that includes what is in the scope of practice in the licensed advanced pharmacy technicians. I simply wanted to get this all in front of you so you can see where this language is, because I expect after we move through a couple other bills, we may take a short break, and I want to have presented this to everybody here, pending that information. Should we not have information that makes us comfortable, allowing for that exam to be required as long as they're making sure that it's within the scope of practice, I have another nice amendment right here that does not include that change. So we'll be able to make that decision once we either do or don't get a letter from the exam authority stating that they will disclose that to board members with an appropriate non-disclosure agreement. So I'm just trying to make sure we're passing the best legislation we can. So I will recess 5. Actually, is there any further discussion on this right now? If there's none, I'll recess this until a little bit later on this morning. Thank you. Sorry that we're popping around, but I think that's the best way that we can get through these bills. Next, I will open the executive session on Senate Bill 298. Representative Grota, you have an amendment and you'd like to speak to that?
I do think. Thank you. So I sent around committee, it's an amendment 1742.
1741?
1741, yes, thank you. So this was, this helped, there were several questions during the hearing on this. So the first section, which is section 5, lines 5 through 9, basically puts a definition as to what recovery residence is. The other is in section 13 through 16. It adds some clarity as to how the department can revoke the certification as opposed to excluding the residents from the list. Because up until now, this is a voluntary process, and if you and the bill over the underlying bill makes it a mandatory process. The section on the next page, lines 4 to 5. Bless you. Actually, yeah. The required form shall be filled with the department no later than 30 days. So it tells you when the registration is required and tells you it strengthens what is required for reporting to DHHS. So I think that this adds more clarity and definition to the underlying bill.
Thank you. Is there anybody who wants to discuss this at this point, or is this something that we want to read through when we take a little bit of a break before we discuss this more? Representative Slotchie?
Thank you, Madam Chair. And I just have a question, not that it needs to be answered right now since we're not going to take action, but the section 13 through 16 or page or line numbers 13 through 16.
Yep.
Just reading through them, it seems that we're relying on the frequency or severity of complaints. And I'm just genuinely curious as to, is there a sort of an administrative or judicial process that goes along with that before certification is revoked, or is this just standard practice across the board?
Maybe it should be this. I'd like to think that it's more structured than this. So let me look into that.
Thank you. And then I actually did have one question. When we were looking at the recovery residences, one of the things we wanted to make sure was that just a private residence doesn't somehow get swept into that. I do like what's there, but would you object to adding the word other between any and business on line 7 so that it says the environment or any other business holding themselves out as a recovery housing, sober living, or recovery residence, to make clear that we're only talking about businesses as a residence?
Yes, that's fine. I can do that.
Thank you. Just trying to look at those unintended consequences. Are there any other questions people want to raise at this point on this? All right, seeing none, we'll recess this until a little bit later as well, so we can read through, get a couple more answers. Let's see. And with that, did you have the amendment already for 486 or not yet? Okay.
Can I, Brad?
So we are pending on the 504. We're going to take a little bit of time just to look into 298. We have our qualifications. So with this, actually, I'd like us to take just a 15-minute recess right now, just to take a look at these, make sure that we're able to read into it, take a look, and make sure that what we're talking about is what we're intending to vote on. So we will be back here at, let's make it just over 15 minutes, at 10:50. So thank you. We'll be in recess. Welcome back to the House Executive Departments and Administration Committee. I will reopen. Hold on, let's close that door. I will reopen the executive session on Senate Bill 486, and I move Amendment 1747H, which has just been distributed. Is there a second? Seconded by Representative DeRoy. This makes the changes recommended by the director. So it says rules adopted pursuant to RSA 167:3-C1, and then removes that phrase at the end. With that, I believe that this makes it clean. It'll keep the process straightforward and consistent. And I'm not sure if there's any further discussion or if we're ready to vote. Seeing no further discussion, when the clerk is ready, he can call the roll.
When adopting Amendment 1747H on SB 486, Representative Slutchy.
Yes.
Clerk votes yes. Representative Devoid.
Yes.
Representative Bailey.
Aye.
Representative Willett.
Yes.
Representative Tebow.
Yes.
Representative DeRoy.
Yes.
Representative Kelly.
Yes.
Representative Groda.
Yes.
Representative Schmidt.
Yes.
Representative Davis.
Yes.
Representative Dargy.
Yes.
Representative Howard.
Yes.
Representative Long.
Yes.
The chair.
Yes.
15-0.
The amendment passes. I would like to move ought to pass on Senate Bill 486 with Amendment 1747H. Is there a second? I'll second. Seconded by Representative DeRoy. Is there any further discussion on this bill? Seeing none, when ready, the clerk can call the roll. I'm sorry, we're moving faster than you are.
We are Representative Slutchy.
Yes.
Clerk votes yes. Representative DeVoy.
Yes.
Representative Bailey.
Aye.
Representative Willett.
Yes.
Representative Tebow.
Yes.
Representative DeRoy.
Yes.
Representative Kelly.
Yes.
Representative Groda.
Yes.
Representative Schmidt.
Yes.
Representative Davis.
Yes.
Representative Dargy.
Yes.
Representative Howard.
Yes.
Representative Long.
Yes.
The chair.
Yes,
15-0.
the motion passes 15-0. Is there any objection to the consent calendar? Seeing none, I'll put that on the consent calendar. Next, I will reopen the executive session on Senate Bill 504. Was my motion to adopt the amendment still pending when we recessed? I believe it was. Let's see where that one went. There we go. And once the clerk has the sheet, I'll see if we have that already noticed with the motion and the second.
Leon and DeRoy
Okay.
move the amendment. What number are we talking about?
We're talking about, I've moved amendment 1742H, which was
Okay.
seconded by Representative DeRoy. So looking at this, the licensing advanced pharmacy technician exam is solely a jurisprudence exam. So we do have a letter from the from that organization which does the tests, and they've stated that they will make this available to the board, subject to non-disclosure agreements. And so since the National Association is willing to do that, I believe that it's appropriate to continue the examination requirement with the language that any examination requirement for licensure shall be limited to the scope of practice, and such requirement shall be suspended if the board is unable to verify that the exam complies with the board requirements. So I think that's good policy. I think we might see a bill next year that says that any exam that the boards can't see will be suspended, because we do want to make sure that what we're testing them on is what the boards want. But we're dealing with this simply in licensed advanced pharmacy technicians right now. Is there any further discussion on this amendment? Seeing none, when ready, the clerk can call the roll.
On the adoption of Amendment 1742H on SB 504, Representative Slutchy.
Yes.
Clerk votes yes. Representative DeRoy.
Yes.
Representative Bailey.
Aye.
Representative Willett.
Yes.
Representative Tebow.
Yes.
Representative DeRoy.
Yes.
Representative Kelly.
Yes.
Representative Groda.
Yes.
Representative Schmidt.
Yes.
Representative Davis.
Yes.
Representative Dargy.
Yes.
Representative Howard,
Yes.
Representative Long,
Yes.
the chair,
Yes.
15-0. The adoption of the amendment.
And the amendment is adopted. I will move ought to pass on Senate Bill 504 with Amendment 1742H. Would you like to second that? Seconded by Representative DeRoy. This bill is an important one, both to make sure that we have access to care and as part of the commitment that the state has made to the Go North program. This is one for the rural healthcare access, and it's important policy to move forward on. And so with that, is there any further discussion on this bill? Seeing none, when ready, the clerk can call the roll.
As stated by the chair, Representative Salatchi.
Yes.
The clerk votes yes. Representative DeRoy.
Yes.
Representative Bailey.
Aye.
Representative Willett.
Yes.
Representative Tebow.
Yes.
Representative DeRoy.
Yes.
Representative Kelly.
Yes.
Representative Groda.
Yes.
Representative Schmidt.
Yes.
Representative Davis.
Yes.
Representative Dargy.
Yes.
Representative Howard.
Yes.
Representative Long,
Yes.
the chair.
Yes.
15-0 and adopt what passed.
What was the
It
That
is
is 1742H. Fantastic. Thank you very much. So I'll get that report written and I'll close the executive session on Senate Bill 504. We've got, so we voted on Senate Bill 486. So that one was ought to pass as amended. Senate Bill 567 was ought to pass as amended. Senate Bill 572 was ITL. Senate Bill 504 ought to pass as amended. And so we still have Senate Bill 298, Senate Bill 569, and Senate Bill 488 that have been noticed for executive sessions this morning. With this, I do think that we do need a little bit more time to take a look at the Senate Bill 298 content. I still think that we should make sure that we have the right policy and take the time with an interim study, but I will take my time doing my homework to see if we are close enough on what we have in order to be able to move forward. Representative Schmidt?
Thank you. Just for the record, Madam Chair, so all those motions are with amendment, not as amended. Okay?
Correct.
Correct? Right?
Correct.
It's not as amended until the House votes on it.
Correct. I was just trying to summarize what work we have already accomplished
No, no,
today, and
I-
I appreciate the correction. Parliamentary procedure is very important. So thank you. I will actually move to recess our executive. Representative Dargy?
I have a question. SB 504, was that consent calendar? I didn't hear you say that.
I didn't say consent calendar. I'm just going to leave it on just in case there is any of that language around the jurisprudence exam that needs to be tightened up, just so it doesn't come off and then put it at risk by it showing up later in the process.
So it's on regular calendar.
Regular calendar, yes. Correct.
I got 5, 6, 7 is on regular calendar.
Okay.
We have not voted 567.
We did.
Uh-oh.
567.
Yeah, all right, okay, regular calendar, but we're waiting on the other, not the,
Oh, we're waiting on that finalized amendment on if we have it as the son of the amendment.
okay, so it
Did
is,
it, do we want to put that on the consent calendar? Is there any objection to putting that on the dental on consent? There's no objection to putting that on the consent calendar, so we'll put that on consent.
So 5, 6, 7 is on consent.
567 is on consent. 504 is on the regular calendar. Okay. Fantastic. Thank you. So I am going to recess the executive sessions on Senate Bill 298, Senate Bill 569, and Senate Bill 488 to next week. Should we meet at 11 for that executive session and then do a committee lunch after that? Is that the 6th? Sorry, on the 6th, yes.
How long do we anticipate it's gonna go? So I have another commitment at 2, but if we can be done by then.
I expect that we will exec them before we go to a committee lunch. The committee lunch will last as long as you're able to join us, but I think we'll probably get kicked out before 2 o'clock from any place, unless we keep buying food.
Then that's fine.
Wonderful. It's, you never want to squat on a table for too long.
So you said
So.
10 o'clock.
11 o'clock. I expect that, generally we're able to work through things, recognize where we agree to disagree very well, which is actually something I love about this committee. So I think starting to meet at 11 on the 6th will work for us for our executive session. And with that, we have a work session scheduled for Senate Bill 640 at 1 o'clock. So we'll be back for that work session, and we are recessed until then. If there's any of you that do have a commitment and just wanted to watch on on Senate Bill 640, that's absolutely acceptable as well. So we will see those who are back at 1. Thank you. Hello and welcome back to the House Executive Departments and Administration Committee. I will open the work session on Senate Bill 640. Anybody who's here and wants to speak to us about this bill, if you could fill out, oh, I do not have the pink card. We have pink cards right here. We'll put those out so that you can give us your information and we can hear from some people who are here to share some wisdom with us. So I'll give ourselves just a moment. And as we put that out, I will also bring up that it's definitely come to my attention that the president's executive order around AI does have the potential to put funding at risk if the states are regulating AI in a way that he does not deem as compatible with the national strategy around AI. So I think that it's important for us to recognize that there may be funding risks from moving forward with legislation regulating AI at this time. So just going to give us probably 3 minutes until I'll just recess for another 3 minutes as people fill out cards if they're looking to speak. Thank you. And if there's anybody else who is, yes, the pink cards are over there. I have 3. So with that, I will start by recognizing Stephanie Griffin, if you'd like to come up and speak to us about the bill. You said 5 minutes, so I'll keep you to the 5 minutes. Thank you. Could you push the button so it's red? And then I'll also need you to introduce yourself. And if you're representing somebody, state that for the record as well.
I will do that. Yes, thank you. My name is Stephanie Griffin. I am representing the New Hampshire Psychological Association. I'm also a licensed clinical psychologist in New Hampshire. We are opposed to the bill. There are a couple of aspects of the bill that I wanted to highlight that we have concerns about. Section 4B, which is on page 3, line 4, indicates that no person, corporation, or entity may provide, advertise, or otherwise offer therapy or psychotherapy services or therapeutic communication, including through internet-based AI, to the public in this state unless those services are provided by a New Hampshire licensed mental health professional. I wanted to note that there are legitimate and scientifically tested and FDA-approved therapeutic tools that are used by mental health providers to supplement the work that is done in therapy sessions. These tools do interact directly with individuals, that they do not involve the therapist. As an example, somebody might be doing work to challenge cognitive distortions that lead to depression. And so they work with a therapist in session around that, and generalizing and practicing skills between the weekly sessions is very helpful in terms of increasing efficacy of treatment. And there are tools that are designed to do that, where the individual is interacting directly with an AI tool. This allows improved outcomes. It also allows, in some cases, less need for interactions with therapists. We're in a mental health crisis. Individuals struggle to find therapists. There aren't enough to go around. Limiting the ability of psychotherapists to use tools like this would have an adverse impact on mental health in the state of New Hampshire. So that's one concern that we have. The other concern that we have is related to the several aspects of the commission that are described in this bill. So Section 5B, the composition of the commission, we would generally support, if this bill were to pass, we would generally support a commission. However, we have concerns that the membership is not adequate. For example, I think most members of the committee heard Dr. Jacobson testify. He's an expert in the use of AI in mental health. Dr. Jacobson or an individual like him would not be part of this commission. And I think we would all agree that if we were looking at a commission related to AI and mental health, we would want someone like him as part of the commission. So we have concerns that the membership is not adequately defined and not broad enough to capture all of the stakeholders and all of the experts who could really speak to these issues. We also have concerns that the length, so this commission would have about just a few months to study and report on its findings, which we find to be insufficient. If the bill were rolled out, the changes and understanding the outcomes in terms of impact on mental health, 3 months would not be sufficient. And then finally, the goals of the commission are not operationalized in any way. So the goal is to study mental health and AI and mental health, but there are no clear, there are no clearly defined goals for what the commission would be studying. And so we would ask that those be established. We've provided in writing to Senator Pearl some recommendations about the changes to the commission that we would recommend. How am I for time?
You have another minute.
Oh, okay. Then the final thing that I'll say is that, as was discussed during the hearing, the primary arguments in support of this bill are that there are individuals who are accessing entities like ChatGPT, and as a result, there are some tragic outcomes such as suicides. This bill, as written, would have absolutely no impact on entities like ChatGPT. ChatGPT does not claim to offer mental health services. They, in fact, have disclaimers that would make them not liable for any of the adverse outcomes associated with using their service for mental health. And there's a lot of research that shows that by far, individuals are using these generic chatbots like ChatGPT and Claude. Those are the primary means that people are accessing these mental health supports. And this bill would have no impact on those services. It would only have an adverse impact on access to mental health in New Hampshire. So I'll stop there.
Thank you very much. Are there any questions from the committee? Seeing none. Thank you very much. Oh, sorry. Yes, sorry. Representative Schmidt, I had looked past you before your hand went up. I apologize.
Just not as fast as I used to be. I used to be able to get the guns out right off the bat, but that doesn't work anymore. So in any case, thank you very much for being here, Dr. Griffin. You brought up the case that I wish to pursue in my questioning. Obviously, there are people who could kill themselves all the time in all kinds of ways, right? So there's nothing that we can do, in my opinion, that can prevent anybody from killing themselves if they're truly intent on it. But the idea that that this young man, as we understand it, went on ChatGPT and ChatGPT, and instead of helping him, it taught him how to hang himself, I think, or something like that. Well, I think that none of us can have anything except horror at that kind of an outcome. And I'm I've lived a long, long life, and I've seen people. I've read about people killing themselves. So I'm not. I know I'm not silly enough to think that we can prevent that, but certainly the idea that there is something out there that is doing diametrically the opposite of what a therapist would do, and so my personal sentiment is that I have nothing against these tools being used in the presence and and maybe under the direct supervision of a therapist, a trained, licensed therapist. But can you speak to the issue that I'm raising when the person is doing something off on their own, even in between sessions? So can you speak to the
Absolutely, yeah.
some way that we can have a greater degree of assuredness that they are not going to be assisted in the wrong direction by some kind of a tool that's out there?
And that's certainly a concern of New Hampshire Psychological Association as well. And I just want to reiterate that. So we absolutely are concerned about the use of tools like ChatGPT for mental health services, because that is not what they are designed for. They're not regulated. There's no licensed professional involved. But I want to reiterate that this bill would not impact use of ChatGPT in any way. There are a number of bills that have been passed in other states across the country that have gone about this issue in a way that we think is much more effective, or would be much more effective, which actually is an effort to regulate the entities that are creating these chatbots by imposing limits with regard to age of use and other vulnerable populations, and in addition, ensuring that those companies are building in things into their software so that as an individual is interacting with, say, ChatGPT, there are regular kind of pop-ups and reminders to the person that you are not talking to a real person. Whether that is ideal and sufficient remains to be seen, but that type of legislation where, again, it's really targeting the entities that are producing ChatGPT and other AI tools, that we think would be a much more effective way of going after these uses of technology.
Follow up.
So, if you're saying that there are other states that have methodologies in law, and have been successfully, prosecuting this whole subject for several years, so that we see that this is successful. I mean, we just as an example, I know when powered flight and human flight had not yet been successfully designed, there were all kinds of craft that were designed, and people jumped off of bridges with. You've probably seen videos of movies of people trying some kind of a concept, and they jump off the bridge and they fall directly in the water. Sorry. Check that box. That doesn't work. So we know now how to design an airplane so that it will work. And to the degree that some other state has been doing it the right way for a considerable amount of time, I'm not dedicated to the idea that we have to invent our own way. We don't want to do it the same way some other place is doing. No, I'm happy to follow the successful methodology of some other state. And are you telling us exactly in your testimony, what it is that we have to do that's different than this?
I think that that question is very broad. I think that a full rewrite of the bill probably would be better done with an introduction of a bill in the fall to look at some of these other regulatory ones. And I do think that if people can provide us insight on what they think would be helpful, I think that would help us towards our continued responsibility.
Whatever
there.
works, Madam Chair.
Okay.
If we need more time, takes just about 9 months to have a baby. It's always better to have the full 9 months than it is to have a preemie.
Can I
And
expand on your analogy?
I'm okay with that.
Yes,
I
and
ju-
you can answer to the extent that
Sure.
you think is reasonable for this. I just wanted to make sure that we weren't workshopping a full rewrite of the
Yeah,
bill at
yeah.
this point.
Yeah, and I'll just expand briefly on the analogy of the airplane. So the way that we successfully made flying airplanes safe was by regulating the companies that are producing or that are building airplanes, not the pilots flying them. And this bill really is attempting to regulate, the pilots, the therapists, rather than the companies that are building the airplanes. Obviously, pilots have their own, law and ethics and so on that they abide by, which we do as well. So.
Thank you. You're basically looking at if there's inherent safety problems in the plane, regulating the pilot won't overcome that inherent safety problem. Thank you. Are there other questions? Seeing none, thank you. And thank you for that analogy. Next, I'll call up Lynn Courier, please. If you can introduce yourself and state who you represent, that would be helpful. And you said 5 minutes, so I'll give you 5 minutes as well.
Thank you, Madam Chair and members of the committee. For the record, my name is Lynn Courier. I am the Executive Director of the National Association of Social Workers, New Hampshire chapter. I am an LICSW, though I have not seen a client in over 20 years. I live in Pennacook. That's me. The way that the bill is written is just to prevent independent AI therapy. And it gives OPLC the tools that it needs in order to go after entities, the makers of the airplane, if you will, from if they provide therapeutic services as unlicensed practice. And that's what we're looking at right here is unlicensed practice, whether it is an individual or it is an AI chatbot. We know that there are clinicians who use AI informed, AI adjacent tools. And there's a carve out right there. It does not preclude FDA approved products or HIPAA compliant products. That allows for clinicians who are using AI to do some therapy notes. Those are those provisions. Our concerns are these platforms that have no humans, no licensed professionals attached to it, just happening. We disagree with the idea that you can't go after ChatGPT or some other entity that says it's for wellness or says it's a companion, says that it's not, it says, oh, this isn't really therapy. If a creature waddles in here and quacks, just because he says he's a rabbit doesn't make it so. Just like OPLC can have a finding against an individual person who says they're, let's say, a life coach. If they are providing therapeutic services, OPLC can go after that person and say, you are doing something that you're not licensed to do. This gives OPLC the tools that it needs to go after AI companies that are providing therapeutic services, regardless of whether they call it therapy. If it gives a diagnosis, if it starts doing providing therapeutic communications or services, if you'll call it that, using evidence-based or non-evidence-based modalities, that's something that needs to be provided by a licensed professional in this state. We would like to protect the people of New Hampshire from these entities providing something that they do not have the legal right to provide in New Hampshire. And with that, I'll conclude my testimony, and I'm happy to answer any questions that you might have.
Representative DeVries?
Thank you, Madam Chair.
The objection that has been voiced to date is that certain of the large model AI tools, such as ChatGPT and such as Claude, are not covered by this bill. Do you have any response to that?
Right, that's what I mean when I say just because ChatGPT says it's a companion, right? Or it's providing wellness, whatever. If it starts giving people a diagnosis, if it starts providing therapeutic services, even though it says it's not, it still is. And let's be realistic, there's a lot of other things that need to be done. This is just a small piece of it. However, we know that that laws that have been passed in Nevada and in Illinois have had an impact. Going after ChatGPT, I don't know if that's something. I think that there's the there is the ability there if ChatGPT is doing something that it's not supposed to be doing.
Follow up?
Thank you. Thank you for that. There was also a significant conversation at our when the bill was originally discussed about enforcement. And so if what you say is the case regarding if it walks like a duck, it's a duck. Do you think that this bill as currently written, has the tools necessary for enforcing, and what would that look like? Thank you.
Thank you for the question. I'll let Director Jurius answer like the more technical things, but I believe from her testimony during the hearing, the $10,000 fine that could be levied against non-licensed entities or individuals would further give them the tools to be able to go after unlicensed practice. Thank you.
Thank you. I would like to ask you, this looks, reading this, it says that offering emotional support, reassurance, or empathy in response to psychological distress is therapeutic communication. Is that correct?
Yes.
Thank you. And then as a follow-up, it says that no person shall provide this unless they're provided by a New Hampshire licensed mental health professional, and that doesn't apply to religious counseling or peer support. But those are the only carve-outs. Yeah. So this would state that offering a friend that compassion would technically violate this statute.
Thank you for the question, and I believe that those are definitions that are already in statute.
Those are in this bill. They're put into the definition section that's added to statute with this bill. So that is for this limitation that it adds this, and this has it on page 2, line 30 and 31. So that this would make it unlicensed practice for me to comfort somebody. The question is if it's interpreted and if it's actually prosecuted by OPLC, but that's a pretty big hole, and you could put a lot of semi-trucks through that.
Yes.
Yes. I want to say that
and I'm not, I would have to look at it more closely, I believe, yes. But I don't believe that's what's intended. But yes, if it's written, then maybe it needs to be changed.
Thank you. And that is the challenge with it. I do want to say that I've spoken with you before.
Yeah.
I support the intent of what you're trying to do in order to protect people through this legislation. It's just a matter of looking at some of these challenges.
Thank you. And I believe that this would provide a stopgap measure while the commission is meeting and kind of really fleshing things out, because it's a moving target, a fast moving target.
Thank you. Are there any further questions? Seeing none. Oh, sorry, Representative Schmidt.
Thank you, Madam Chair. You referenced in your remarks a few moments ago that there are carve-outs for religious purposes or religious sphere. And one other thing that escapes me at the moment, but I mean, some of us are, I think, looking around, we're all old enough to remember David Koresh in Waco, Texas, and Jim Jones down in Jonestown. Jim Jones led something like 900 of his followers to commit suicide.
Yes.
Koresh, I think you could debate if you looked at the video and so forth, who started the killing, if you will, in Waco. But so if obviously if somebody is taking money for whatever you're going to call it, therapy, if they say therapy, then I am sure that OPLC already has the power to regulate them.
Yes.
Again, I'm happy to take more time. If some other state has got some kind of a model that we could follow, rather than inventing it ourselves.
Yeah.
Because the chair has already indicated, and several of the witnesses shaking their head in agreement, that this bill needs more work, or it needs to be changed. So I want to get it right before I get on board that plane.
Thank you. Do you have a
Thank you.
response to that, or I think it was more of a statement?
It was, and my response is that our primary concern, again, is that these AI bots do not have critical thinking skills. They cannot absorb nuance. They don't know when the person who's typing in is hedging, outright lying, or is obfuscating something else going on. That's why we have licensed, trained professionals. And that's why AI can get it so terribly wrong, because all it is predicting the next word based on a lot of data, some of which is helpful, some of which is not. And we believe that this bill provides a stopgap until the commission can meet and make some further recommendations, while still at the same time providing the opportunity for clinicians to use those FDA tools and HIPAA compliant platforms.
Thank you. Any further questions? Seeing none. Thank you very much. I appreciate that. And next I'll call Dr. Hines. You've asked for 3 minutes, but we've given 5 minutes to everybody else, so I'll give you 5 minutes as well.
Thank you, Chair Leon, and thanks members of the committee for holding this work group and listening to our feedback on this bill. So my name is Dr. Michael Hines. I'm a psychiatrist by training. I'm faculty. I'm an assistant professor at Dartmouth College. And as part of that role at the college with Professor Nick Jacobson, I led the first randomized controlled trial of a fine-tuned generative AI chatbot for treating mental health symptoms. And I can get into that a bit more. We found good results there. We found that people really benefited from interacting with a generative AI chatbot that was overseen by trained clinicians, and we found it as a way to sort of scale care. We know there's a huge gap between need and demand for mental health care, and so we found that this is a really promising direction for delivering high quality mental health care to people who need it. And wellness support. Aside from that, I also am a practicing psychiatrist, and I see clients every week. And I do have, to earlier comments that were made about this bill, I do have clients right now who are using ChatGPT, Claude, and Gemini for therapy and relationship advice and everything in between, with mixed to negative results. So we've seen not great results when people are using these general purpose frontier models. The comments that I'm hoping to really make on this bill are around Section 3, primarily, that I think we've kind of been, that has been the focus up until this point. I think there was an earlier, I think we have a similar, everybody in this room has a similar intent to try to protect consumers from harm, from sort of untested general purpose AI models. I don't think this bill, I'm very certain this bill is not the way to do that. And I work with many other psychiatrists and psychologists who are certain that this bill is not the way to do that. Because, and this point has been made already, that people are using these, and I see people, like I mentioned in my practice, using these general purpose models. This bill is not going to target Claude, Gemini, and ChatGPT. It does not have teeth to hold those companies accountable. What we do believe it's going to do is it's going to halt research in the state of New Hampshire that we need to answer the questions that are coming up today. The bill that was referenced in Illinois, I am familiar with, that is very similar to this bill that was passed in August 2025 in Illinois, and that actually halted a collaboration that we had with a university in Illinois to study these technologies because it would have become illegal to test these in the state of Illinois. So I can say firsthand that this would shut down research, not just in mental health, but given how broadly, as you pointed out, the therapeutic communication piece is defined, that what qualifies as therapeutic communication would also shut down research looking at these technologies for wellness and flourishing. The other comment I was hoping to make is this bill makes reference in Section 3 to the FDA. And to tying to making a small carve out for FDA approved technologies. We have pretty significant concerns about that as well, given the fact that the FDA has not yet indicated when and how it's going to regulate these technologies. We were part of the FDA Digital Health Advisory Committee that was held in November of 2025, and it's very clear after that that as far as the FDA is concerned, it's not clear whether they're going to be the ones even regulating these. And I know there's federal efforts right now looking at potentially even making another agency that oversees these kind of technologies. So I would have concerns with tying state law to the FDA for that reason. And the executive order came up earlier. I also wanted to bring that up, that there is this executive order that really has I think tried to put a task force together, bless you, in particular to try to prevent this kind of sort of a patchwork, where some states we make it totally illegal, in other states it's not, and sort of there's this executive order that we're also aware of that's out there and going to be looking at kind of looking at different state laws and trying to sort of see which of those make sense and which don't. That's really the extent. I don't know where I'm at as far as time.
I stopped it a couple seconds ago so that it wouldn't ding when it sounded like you were concluding your remarks. So very good timing.
Thanks.
And thank you very much for being able to join and provide the impact of what happened with the Illinois legislation on your research. Are there questions from the committee? I think, I guess I wanted, sorry, yes.
So Dr. Jacobson, Professor Jacobson, submitted a proposed amendment. So I just wanted, I assume you're aware of that.
Yeah, I helped him. We worked together on that.
So is this amendment language that you would actually endorse if this bill didn't exist, or is this something that you are would consider less bad than what you think of the bill?
I think we consider it less bad. I think our strong recommendation and hope is to not have this bill, period, to kill the bill. Or rethink it substantially.
To put it aside and come back next year.
Yeah.
Representative Schmidt, did you have a question? Or was that answered? The same question. Perfect. Thank you. And then my question, Representative Slotchi, and then I'll ask you one as well.
Thank you, Madam Chair. As I understand it, the requirement of licensure imparts a strict liability on those who would practice a trade, meaning that you don't have to premeditate the violation of the license. Just performing the act would be a violation. And obviously, companies like ChatGPT aren't, I would assume, intending to provide these services, and in fact, they've gone out of their way to say that they're not these services. However, in my experience, when using AI, it's very easy to game the AI into saying almost literally anything. If you front load the context of an AI that we're playing a game and, oh, won't this be fun? Hey, let's play doctor. You can get it to do all sorts of wacky stuff. And because the AI companies would be subject to that strict liability, in your opinion, would that, even if it were gamed, would that be sufficient to indicate a violation of this law?
Yeah, I think that's a great question and something the field is thinking about. I think it's exactly why we need more research to look at this, to sort of red team these agents, to test, to sort of stress test them. And that's actually a lot of the research that our lab is doing right now, is looking at how people try to break these. To your other point about, to your point about people using ChatGPT for therapy, I think it's, people absolutely are. And you don't even, at this point, you don't even have to trick it. It'll provide wellness, it'll provide advice and wellness advice and mental health advice of all kinds. And I think what legislation like this will do is actually just make these push these companies further into disclaiming any kind of therapeutic intent, knowing kind of full well that that's what people are using it for.
Thank you. And then my question for you is, you said that you had met up with the FDA and others in Washington to try and look at what the regulatory pathway was. And I just wanted to confirm that they didn't come away with that, with a direction of how to look at it, whether it's the devices, the biologics. But the big question was, is this even the purview of the FDA?
Yeah, that was, and I sat in on that. Nick Jacobson actually testified, and we did that virtually. But I've listened to the different testimony during that hearing, and that was my takeaway from it, was that there's not a clear path forward or a clear way that the FDA would do this.
Okay.
And I know there are others right now looking at, is this even in the purview of the FDA, or should it be another federal agency?
Okay. Thank you. That's very helpful. Just as an aside to the committee, they've been trying to figure out how to regulate stem cells for over 20 years, and they still don't even know which direction they're going to take on those. So,
yeah,
yes.
That's tough.
Just because the FDA isn't ready to move doesn't necessarily mean there's not a spot for the states, but this is pretty early in the game, correct?
Yeah, I agree.
Thank you. Are there other questions? Seeing none, thank you.
All right, thank you for your time.
With this, I think, is there anybody else who is here to speak in this work session? Seeing none, I'll close the work session and I'll open executive session on Senate Bill 640. Representative Slotchi, did you have a motion?
Yes, thank you, Madam Chair. I would move inexpedient to legislate.
And is there a second? I'll second. Seconded by Representative DeRoy. Would you like to speak to your motion?
Absolutely. I think the important points to take away here is that there is a real problem. People using these types of chatbots is to render themselves therapy is dangerous to themselves, and it's dangerous to the community at large. But the unfortunate nature of the problem is that it is so complex, and it's almost a problem that is too big to solve, especially at the state level. And so I look forward to further research on this subject matter. I think that, the folks that are directly involved with this product are going to be able to make significant gains far ahead of what we're able to do here as a committee of government that meets once a week for half a year. So, thank you all for your testimony, and thank you.
Would you like to speak to your second, Representative DeRoy? Thank you. I just, to those who were really looking for this to pass, I would just want to recognize that I have introduced bills this year as well, that while they had what I believe was a very solid trajectory and path forward, some of those were deemed try again next year. And so I've gone through this process myself. Just because a bill is inexpedient to legislate doesn't mean that it's not an idea to keep working on. It's just one where for this year we're done. I actually would like to note that there was the talk about the stopgap, but that made me think about tourniquets. You know, if you put a tourniquet on wrong, you can have some pretty devastating consequences. And I think we're all trying to solve this problem. We're just trying to make sure that we don't bring in additional problems or challenges in the process. Is there anybody else who'd like to speak to the motion? Seeing none, when ready, the clerk will call the roll.
Representative Slaptree.
Yes.
Clerk votes yes. Representative Bailey.
Aye.
Representative DeRoy.
Aye. Can't believe I just said that.
Representative Groda.
Yes.
Representative Schmidt.
Yes.
Representative Davis.
Yes.
Representative Dargy.
Yes.
Representative Howard.
Yes.
Representative DeVries.
Yes.
Representative Long.
No.
Chair.
Yes.
Let's see. 11-1. 12. That can't be. Here, 1, 2, 3. Oh, yes, yes. 12-1.
Yes.
I thought there were
It,
4.
it's 11-1. You'd had this partial mark here. So 1,
okay.
2, 3, 4, 5, 6, 7, 10, 11.
11.
So the motion passes 11-1. Do you have an objection to this going on the consent calendar? No. So this will go on the consent calendar. Thank you all. We have concluded for the day. We'll notice the remaining 3 bills for executive session at 11 o'clock next Wednesday. And the committee will be looking to go to lunch together after that. So thank you. Have a good week, and we'll see you. We're adjourned.